Right, well, let's now talk to Dr. Tony O'Sullivan, who is the co-chair of Keep Our NHS Public. Tony, I mean, a lot of people messaging in the show, David, they're saying that it's a bit difficult to stay sympathetic when you look at the amount consultants are being paid and them saying, well, it's not enough, we're really struggling. What do you think?
I think we need to go to the cause of the current situation and who's to blame. And there's no doubt that the crisis in the NHS has been going on for and escalating for many years now. The waiting lists have deteriorated drastically from an acceptable level around 2010 to 4.5 million before COVID, and now it's inexorably going up. And actually, although the strikes are clearly having an impact, and the doctors themselves regret that, as did the nurses and the ambulance staff and so on, though numerically that's a minor part of the 7.6 million in terms of who's to blame. And to me, this is a little bit like an abusive situation, an abusive relationship. The government's been actually abusing public services over the last few years. They've left the NHS and education with its collapsing school roofs and social care in such a mess that even though we have had the best health service in the world, we could not cope with COVID, and we've got one of the worst outcomes in COVID in the world, especially amongst the advanced nations. If you have an abusive relationship, you go to the person or the organisation that holds the power to look for the blame, and it is this government that is totally to blame for the demise of the NHS.
So what is the solution here then, Tony? Because people will say that there's a record amount of money being paid into the NHS now. It's not that short of funding in terms of what it's been paid historically. I mean, it's not enough clearly to keep up to date with the sort of strains on it right now. I mean, is this down to there being an ageing population? Is this down to the fact that medical technologies are advancing all the time, and so therefore new drugs, new equipment costs a lot more money, that people have far more complex medical conditions with obesity-related disease and so on and so forth, and that, you know, we can keep throwing more and more money at the NHS, but perhaps we need to reconsider the model, because at the end of the day, a lot of doctors who are quitting the NHS to go get better paid jobs in countries like Australia are going to healthcare systems that don't copy our model.
Please don't go down the road of throwing money at the health service as though it's a waste of space. You probably know, Alex, if you've done the research, that if we were paid at the same level of the health services in France and Germany, for example, they're good comparisons, we would be, the health service over the last 10 years would have been getting 40 to 50 billion pounds a year more than it's been getting. So it isn't record funding at all. Now, you know, when you take into account inflation, and when you take into account the rising population and the rising need, as you talk about, and also as you also say, the rising cost of technology, the cost per capita weighted according to need and population size has actually started to go down in the last few years. Every time the budget increases by £1 million, that is record funding, but it is not record funding according to need. And I think it is the duty of journalists to analyse those assertions by government, you know, talking about record funding, record doctors, record nurses. It's the population's need that is the relevant question. And there's been unacceptable treatment of the NHS, and I would say of social care and education as well. The premature deaths are shocking. 500 avoidable deaths from ambulance delays in last year, but even more shocking, 500, as I'm sure you've discussed on this programme, 500 avoidable deaths each week because of the delays in A&E, and countless thousands of people are dying on the waiting list, and that is not because of the strikes. That is because of the structural damage done to the NHS and indeed social care by this government. So the harmful policies have to be changed, and that is the responsibility of the people in power in this abusive relationship I blame the government.
Well, I mean, do you know what? In many respects, I agree with you then. I'm glad you mentioned France and Germany, because I used to live over on the continent of Europe, and most of them have a European healthcare model, which is a hybrid system. It is part insurance paid through the workplace. For those who haven't got that protection, there is state funding. And I found that medical care on the continent to be utterly exceptional. I could get a GP appointment on the same day, would you believe? But I'll tell you one thing as well, Tony. When I fell over on the cobbled streets of Belgium and broke my ankle into many bits, they wouldn't put me on a gurney and send me to an operating theatre until they knew that I was going to pay for it. They weren't prepared to lift a scalpel, frankly. And I do wonder if we, you know, with the growing population, as you quite rightly point out, it isn't about what we've paid in the past, it's about what we need now, that maybe the government aren't the right people to be in charge. Maybe it is time to put people in charge of the NHS who aren't going to treat it as a political football and say, well, you know, the NHS has had its moment. We need to be looking at a European model.
Well, the funding for our public services come from taxation, and the government dispenses that taxation. So we can't get away from the fact that the government has responsibility and will continue to have responsibility for public services. But the two examples you gave from Europe are really salutary. I mean, I do not want a situation where people, whether they break their ankle or have a heart attack, have their pockets checked for their credit card before they get treatment. That's not acceptable. When the NHS has been funded properly, it has actually been the model of the world. And although David Bull referred to the fact that it had the second worst mortality rate, and the worst, of course, is America, the vast majority of impact on mortality is to do with social inequality and poverty. The social determinants of health are very powerful factors, and we have one of the highest rates of child poverty in Europe, in this country, one of the worst levels of sickness benefit, and so on and so forth. So, you know, the question of mortality is much more complicated than the health service. But there is absolutely no doubt that if the NHS fails, the last stop that can keep people alive and keep them having some hope is taken away from them. And the responsibility for that, I just have to say once again, the responsibility of that is not with the BMA, it is not with junior doctors or nurses, it is with the government. And they are the power in this relationship. They are the ones that are refusing to talk, and it's totally unacceptable.
Thank you so much for coming on. Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public.